when we're now starting our therapy, right, it's very easy as therapists for us to rely on, psychoeducation, because it's an opportunity for us to test our academic skill, our academic background, what we learn, so it's normal and it's natural to want to rely on our academic foundation to help us with the session. But as you go along, it is best to meet the client where they are and learn the skills as you go along, like through supervision. When you have your caseload, you get an opportunity to try different things, right? Because sometimes a client need a little more than information to adjust to their presenting problem. They don't just need an academic explanation about anxiety or divorce or depression. A 14-year-old need a little more information about why they are failing in class, right? So people need techniques and strategies to resolve conflict, right? And yes, it is good to give proper instruction and proper information about how to resolve conflict and what caused conflict. But that in itself makes the session too clinical. So you got to be a little more. In tune with what's happening in that session. Meet the client where they are, and when we're trying to help the client from point A to point B, right? I'm gonna share some things with you, right? Our job as clinicians is to prevent the continuity of whatever dysfunction that the client is experiencing, and it happens on three levels, right? There is the primary preventionary method, which aims to prevent the development of some sort of disorder, right? So let's just say you have a woman or female or a child who is living in a dysfunctional environment. Your aim then is to probably use strategies and techniques that will inform that child, that will inform that abused woman to deter, let's say, physical abuse from taking place, right? Because it usually starts with some type of tension. It's building up, and you have to be aware of that and bring it to her attention, so that we know after the tension has reached its peak, it evolves into the second phase where you would likely see some type of physical violence taking place, right? And the reason why you want to avoid it going to the second phase, because most women who are in these abusive relationships, they don't survive that second phase, right? So the secondary prevention method seeks to reduce the harmful effect of the disorder or the diagnosis that has already developed, right? So now you want to, let's say you have a client who is presenting with depressive symptoms, right? So you may now want to tell them, suggest strategies or techniques about getting outside, taking some sun, have some type of social support network, someone that they can talk to, incrementally have a plan in place so that they can get back to doing things that they used to do. You may also want to talk to them about medication compliance, taking their medication on time, finding out how difficult it is for them to be compliant with their medication. You would want to suggest to them get one of these organizers with the days of the week, so that they can put their medication in there and they can go and take it, right? And again, you can see based on these two preventionary methods, right, that I've just explained, we're giving the client more than just information, right? And then there's the tertiary level, where the person may have a chronic condition, right? Chronic means in this case long-term, right? So they may have a been depressed even before coming to us in treatment, right? So how do we help that person cope effectively with their chronic condition, right? Again, medication therapy, right? Medication compliance, right? Seeing your therapist, keeping your appointment. So the summary of what I'm trying to get over to you guys is that as you develop your unique way of treating your clients, if you're going to rely only on the academics or the information that you would have read in school or online or from any postgraduate studies, your effort will come across to a sterile, right? We have clients who say, man, I've been in therapy for like 5 years. You just sat with me in one session and I got more out of it because I was able to meet the client where they are.
Thank you. Like, subscribe, and share these videos so that we can continue to address the disparities in mental health services within the communities we serve.